you should be doing, where you should be, where you should go, who you should report to in an emergency. And it's incumbent on us as professionals to make sure we know that information. Within our system of employment or functioning, wherever I work, I need to know what that is. The role we also end up playing in a disaster, during a disaster, is also determined by your level of disaster training. I would not be in a position to go out and manage a operating room in a field hospital setup. I have no training in that. That's not something I can do. I would not be doing that. So your level of preparation and training also determines, to a certain extent, which role or roles, potential roles, you might likely play. You should not be doing anything in a disaster that you're not qualified to do in your usual setting. And it's also the role you play is somewhat determined by the phase of a disaster. In one phase, you may be acting quite differently in terms of your interventions than you would in another phase. So let's look at that and break that apart a little bit more. By disaster phase, if you remember these that we went over, the pre-event, event, relief, recovery, we're talking about activities that certainly can occur and roles that can be played by healthcare professionals in every one of those. So in the pre-event phase, certainly healthcare has a role in terms of mitigation and in terms of preparedness, in terms of educating your peers, educating your family, educating your community, teaching first aid, communicating where shelters will be, determining where altered care sites may occur, being part of the planning process. This is a very important part that the healthcare professionals need to play in that. An event occurs, and then in the relief phase, of course, we're talking about roles that healthcare can play usually now in providing acute care. Those are looking at your acute care skills, and perhaps even if you don't have some skills that are up to date, in many places they provide sort of what we call last minute or at time training. Because I would venture to say if I had to go into a field hospital or to a hospital to aid in clinical care and acute care of victims, there's some things I have not done in a long time. It's been a couple of years since I've started an IV. I suspect I could do it quite quickly again, but I would have to get up to snuff real quickly. There are just some things that I have not done. But I certainly can do immunizations, I can do assessments, I can help with triage, I have a role to play in the acute care phase, even though I might not have every capability to meet the needs of every victim that comes in. But it's important to know what your capabilities are and aren't. In the recovery phase, we have a role within our community to help our systems, our medical care system, become restored, to help other systems, that our public health system become restored, to help in surveillance, to help in the detection of outbreak of diseases, to help prevent outbreak of diseases through community education, through teaching, cleanliness, sanitation, through teaching health promotion, to working in IDPs or tents to assure the health and safety of the victims there. So we have roles to play in recovery. And again, we have a big role to play in the development after an event, in which now we teach a community, ourselves, our families, our neighbors, our children, to be more prepared. To offer first aid courses to young people in the schools. It's your neighbor and your family that you're going to depend on in a time of a disaster. Children can learn. Children in Japan in the 4th grade are being taught radiation safety. So based on the hazards that exist in your community, children are a wonderful source of aid in building resilience, knowing what to do. Do they know what to do in an earthquake? Do they know what to do in a tsunami? And I can tell you, when children learn it, the parents and the grandparents are definitely going to learn it. So it builds out from there. It's a ripple effect. So those are elements that I think we as healthcare professionals should be out advocating for and be involved in all the time. That's one of our big duties and responsibilities in disaster health. So we talked a little bit about one of the things that you might do, and certainly we have a responsibility as healthcare professionals to be part of plans. We should be part of our hospital plan. We should be part of our family or community plan. Do you all have plans? Does your family, how many people in here have a personal family plan for an emergency or disaster? You do? This is probably the very first place you should start. Healthcare begins at home, right? Make sure your family is safe and healthy. Make sure they know. Make sure they have the provisions that are needed. We say for at least 72 hours. Count on getting no help from anybody for 72 hours. And make sure you have the supplies you need, the medications you need. Make sure if you're not at home, you know, people know at home where to go. Try to set up some other redundant communication system. Because even if you're talking about situations in which something happens to the hospital, I can tell you, even if the healthcare personnel at the hospital aren't physically damaged or hurt by an event, if they are unsure about the safety of their home and family, they will not come to work. They will not leave their family and come to work to the hospital if their own family is not safe and healthy. So it begins with that type of thing, and then it broadens out to your neighborhood. Okay, well, just make sure your neighbors on either side of you also know. And then broaden that out and involve more of the community. And certainly we can be involved in response plans and very much involved in education. First aid education, preparedness education. During the relief phase, we can provide acute care, both physical and mental, in caring for the victims. And when I say we provide acute care in the relief phase of a disaster, much of it is like emergency care. However, the focus is very different. In emergency care, we still are looking at a one-on-one, take the patient as the patient comes. And that's how I'm going to treat you. I'm going to treat you quickly, efficiently, and well, but one-on-one. But when we are going out into a disaster world, now, we no longer have that luxury of taking, okay, you're the first, you're the second, you're the third. We now have masses of victims. And so, definite practice that has to be taught to us is how to triage. How to triage with the goal of saving as many people as possible, and saving those that you assess and determine can be saved. And we simply don't have the luxury in that situation of spending a lot of time and a lot of resources on somebody who is probably not going to be able to be saved no matter what, no matter how many resources we use on them. So now in a disaster, we have limited resources. It becomes a whole mental shift of thinking from an individual patient to a population, to a large group, and thinking of the most that you can save instead of which one can I save. So that's the biggest difference between disaster care and emergency care. Some of the same skills otherwise are called upon in terms of providing acute care. And of course we know it's done in austere conditions. It's done in conditions you never want to work in, ever. It's done with no resources and no supplies. And that's very, very hard for us, and that's the other big difference. In emergency care, we give acute care quickly. We respond to the emergency acutely and immediately, but we do it in our normal routine setting where you know where everything is, you have all the equipment and supplies, and you can call somebody in anytime you need to help you. That is not the situation, of course, in a disaster. So the difference is profound between emergency and disaster healthcare. Oops, again, we just focus on populations. We do triage. We are involved in evacuation. Evacuation should be a drill that is done periodically within a hospital. And oftentimes that's a drill that's very frequently overlooked. But I can tell you that it is a skill to learn to evacuate a large number of ill patients and very critically ill patients, and many who can't, who are dependent on life-saving support, moving neonatal intensive care unit patients, as had to happen in the following Hurricane Katrina in New Orleans, where they had to evacuate the NICUs, the NICUs, and the ICUs. And of course, they had to do a vertical up evacuation because the water was coming in as it was coming in from the bottom and filling the floors, and they were flooding and flooding and flooding. And so they had to do this in the night, in the dark, because they had no electricity, you remember. People had to be handbagging the patients. They weren't able to be, the patients who needed to be on ventilators had to be bagged. And then in the dark, with no now elevators that working, you have to get patients up onto a rooftop of a hospital where they laid in the parking lot up there until helicopters could come in at all and start to relieve and remove some of these patients. And of course, many patients died. That evacuation is a very a serious process, and it's a skill that we forget about, I think, too readily. That are we prepared to evacuate our hospitals? And then, of course, we can be very involved in sheltering, setting up shelters, working in shelters, helping to do healthcare surveillance in shelters, where it certainly is an essential skill. And during recovery, we can still continue our work in shelters or surveillance or other care sites. During recovery becomes a very important time during relief, but also particularly during recovery, to identify our vulnerable populations. So as healthcare workers in the community, it behooves us to know who are our vulnerable people, where are our vulnerable people, how are they going to be accessed, how are their needs going to be met, have we addressed it, do we address it in the shelters, Do we address it in any of our other healthcare facilities? And of course, the biggie then is, during relief phase, we know people come in for short periods of time to provide relief and aid